Congratulations and welcome to the growing family of hundreds of thousands of people who are enjoying a more productive and pain-free life with the Stimulator. You have taken the first step by taking control of your pain and helping your body help itself. Watch this tape carefully and you will learn how to get the most from your Stimulator. The Stimulator has worked wonders for me, and I'm sure it will work wonders for you.
The Stimulator was developed as a natural, safe, and effective way to help you get relief from your pain, whether occasional, acute, or chronic. The results brought about by the Stimulator are in harmony with nature and with no side effects as with medication, so you can use it as often as you like. In many cases, the Stimulator helps provide almost instant relief from pain. In others, it may require several uses per day over a period of time to achieve results. Remember, nothing works 100% of the time on every kind of pain. Experience has shown that even if the Stimulator doesn't help totally remove your pain, it may actually help speed healing of the condition causing your pain. As you experience the relief from pain that the Stimulator can help provide, we are sure that you'll want to share it with your friends and family, and you'll want to keep it with you at all times.
This pain was so excruciating. I can't tell you how bad it was. It was almost numbing. And when I found the Stimulator, I used it one time. I did about 10 zaps, and it really helped. And then I waited a few minutes, then I used it again, and it helped a lot more. There's a little soreness left. Then maybe the next day I used it again, and it just really eliminated the soreness.
The Stimulator may be used effectively to help relieve such pain from ailments as arthritis, rheumatism, bruises, stiff muscles, sprains, shingles, back pain, headaches of all kinds, leg pains, carpal tunnel syndrome, bursitis, cramps, shoulder pain, strains, and tendinitis. In addition, the Stimulator may help relax muscles, stimulate nerves, accelerate healing of traumatized tissue, improve circulation, and prevent or reduce scar formation. Now please remember that we make no claims that the Stimulator cures anything. It can only assist your body and nature to do the healing and provide pain relief. Anyone can and should use a Stimulator. However, we caution you not to use it in the following conditions: children under 6 years of age, persons with a pacemaker or any type of electrical medical implants. Pregnant women should not use it in the abdominal area or at all in the last trimester. Persons with a malignant tumor, in the presence of pure oxygen or any other flammable gas or liquid, over any metal surgical implants, or directly over the eye. While the Stimulator may help relieve pain, we make no medical or health claims of any kind, nor should the Stimulator be used as a substitute for medical care. If your problem persists, play it safe. See your doctor or chiropractor.
About 8 years ago, I fell down a flight of stairs and developed sciatica and had pain on a very constant level for about that many years. My husband's a physician, and when we saw the infomercial, he was as skeptical as I was. And I think that the medical profession tends to be skeptical about something that's not proven. But when you use the Stimulator, you prove it. If you want to be free of pain, use the Stimulator. It works. I don't know how it works, but it works. And it makes you feel very comfortable instantly.
The Stimulator should be held in one hand with the thumb resting on the plunger and the index and middle fingers resting on the middle grips with the barrel between them. A tiny burst of energy flows out of the tip of the Stimulator and will pass to the body wherever you apply it. Now be sure not to allow any portion of the hand holding the Stimulator to touch the body, as it will short-circuit the energy burst. To use the Stimulator on yourself, touch the tip of the Stimulator to the general area of pain. Activate the Stimulator by depressing the plunger 10 to 20 times as you move the Stimulator slowly around the area. You don't need to push the Stimulator hard onto the skin. In fact, the Stimulator will even work through clothing. Wait a while, at least 15 minutes or so, then repeat this procedure as necessary until you feel relief. To use the Stimulator on another person, hold the stimulator and apply it as before, except you must complete the circuit or channel for the energy to flow through by touching the person with your other hand as you activate the stimulator. The energy will flow from the tip of the stimulator to your other hand. Keeping this in mind, move the stimulator and your other hand as you activate the stimulator so the energy will flow through the painful area. In the case of a sore or arthritic joint, knuckle, elbow, knee, or whatever, always position the stimulator and your free hand so that the energy is directed through the joint and also above and below the joint. In addition to using the stimulator as we have described, the stimulator also works great on acupressure and acupuncture points, or meridians, on the body. Some sample charts of these have been provided in the instruction manual, and more detailed information can be found at your local library or bookstore. Some of the conditions which may be helped by using the stimulator on acupressure points are headaches, stuffy nose, allergies, sinus problems and headaches, hay fever, stress, tension, anxiety, nausea, depression, and many, many others.
I used to use all kinds of medication and it never did very much good. And I used the stimulator and my sinuses are open, and when they close a little bit, I zap it a couple times and it opens up in about an hour. I've never had anything for my sinuses that did as well as this, and these little pains that I get that I can zap away are certainly a lot better than pain pills.
There are a great variety of headaches, but experts agree that most are triggered by tension. Now, tension is most often felt as a tightening of the muscles in the trapezius, neck, and scalp areas. Now, the first thing we want to do when treating a headache is to stimulate the areas of the trapezius, neck, and scalp the way we see being demonstrated. If you're using the stimulator with a partner, place one finger or hand on one shoulder and the stimulator on the other. Then stimulate these areas several times. Then gradually run the stimulator up the side of the neck with your finger on the scalp. If your headache is on the temples or the forehead, stimulate those areas also. The stimulator is small, so you can carry it with you any place. If you catch your headache at the beginnings of feelings of discomfort, you'll have greater success in controlling them or even eliminating them altogether. The webbing on your hands between the thumb and the forefinger is a classic acupressure point for the relief of headache pain in particular, as well as pain in general. Always stimulate this area as well for headache pain. When using the stimulator on yourself, simply touch it to the area like we are demonstrating. If using the stimulator with a partner, touch one finger to one web and the stimulator to the other web and activate 10 to 20 times. This will stimulate both of these areas simultaneously. Once again, there are a variety of trigger points that may be stimulated for headaches, as well as a wide variety of other pains and conditions.
I really believe that if a person uses it more, that you have to use it less, because I've experienced this with my pain. Things that my shoulders would bother me all the time, and the longer I have this, I find the less I have to use it. The same way with my knees. The more I use it, the less I need it. You can't put a price on good health. You can't put a price on a good marriage. You can't put a price on a lot of things in life. This is one of the things you can't put a price on. How can you put a price on being able to eliminate pain?
If you want to go beyond the basics we've given you, you can find many excellent reference books and booklets at local health food stores, bookstores, and of course your public library. Be creative when using your stimulator. Experiment with different positioning, different points of stimulation, and different frequency of use until you discover what works best for you. Each person is an individual. No two of us are exactly alike, and accordingly, different people will have different results using the stimulator. The most important thing to remember is that you may have lived with pain for a long time. So if you are among those whose condition doesn't improve immediately or on the first day, be consistent in the use of your stimulator and give it some time to work. Use your stimulator in good health. Carry it with you and share it with other people in pain. And write to us. We're anxious to know your personal results using the stimulator.